I just wanted to revisit immunotherapy. On another podcast, I heard you say that its effectiveness in pancreatic cancer has been less than 1%, if I have it correct. But are there centers around the world that are aggressively looking at this and doing any trials with it that might show some hope for its use?
Yeah, there's dozens and dozens. So it's important to kind of walk through the progression. So 10 years ago, there were single agents, single drug immunotherapy. So the anti-PD-1 or PD-L1 agents like nivolumab and pembrolizumab and other agents like ipilimumab. Those drugs by themselves, the response rate, the benefit rate was literally 0%. It didn't help anybody. And there are side effects to these drugs that sometimes can be quite severe. It's not common, but even a 3 to 5% rate of serious side effects is far worse than a 0% benefit. But we also know that immunotherapy works. I mean, Dr. Allison got the Nobel Prize for very good reason because it really, really does work in certain kinds of cancers. The only question is, how do you make it work for pancreatic cancer? What is the nut that needs to be cracked or the glass ceiling that needs to be broken to finally make immunotherapy work? And I think that we're getting closer and closer to that glass ceiling. I'll give a nod to my colleagues up in Baltimore at Johns Hopkins who are doing amazing sequential research, adding more and more therapies to decrease the resistance to immunotherapy so that hopefully it can start to finally work for patients with pancreatic cancer. Because of that, there are literally dozens and dozens of trials that are ongoing all throughout the country, all throughout the world, that are trying to make immunotherapy work finally once and for all for pancreatic cancer, incorporating vaccines, incorporating what we call cell-based therapies. I would never have, in a bat of an eye, I'd be happy to refer a patient like that to a clinical trial. What I would not do, though, is knowing that the single drugs don't work, is I wouldn't take a patient like Carolyn and say, okay, we're going to be done with chemotherapy, and now we're just going to prescribe pembrolizumab, which is called Keytruda, because that by itself won't work. I would be happy for her to be enrolled in a clinical trial of pembrolizumab plus X, Y, and Z in the hopes that those extra agents are going to help.